Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
All right, Hafaday, everybody, and welcome back. Dr. Jitka Lom from Express Care is here, and we're talking about a very, very sensitive and important subject in regards to medicine. Doctor, welcome back.
Thank you.
Okay, well, tonight, we talk about so many different topics. Because October is Breast Cancer Awareness Month, we are talking, of course, about breast cancer. Although there are no signs or symptoms of breast cancer, at least that we know of, what are things people should look out for when it comes to, either self-exams or, telltale signs of breast cancer?
Right. Well, the most common thing that women should look out for are unusual and new breast lumps. One of the things is that most of us women have some lumps in our breasts. It's finding the ones that are new or unusual that's very important. So getting to know your own body is very important. Checking your breasts at least once a month. Looking for a hard stone-like lump. Mm-hmm. Sort of something like an earring or a little stone that you would feel in there rather than soft tissue.
In any particular area?
Anywhere in the whole breast, including under the nipple and going right up into under the armpit, because there's a tail of the breast that travels right in underneath there. Mm-hmm. So that's what you want to look for. Other things would be changes in the skin, unusual dimpling or bleeding, weird nipple discharge, strange fluid coming out of the nipple would be something else to look forward to.
Okay. Okay, and as we always do when we talk about the different medical topics, as we do here on Healthy Living Tuesday, is breast cancer something that is inherited?
Oh, only about 10% of breast cancer is related to the genetics, actually. Okay. Most of breast cancer is kind of random, related to your own personal genetic makeup and your own lifestyle. About 10% is related to family history, strong inherited tendency.
Mm. Now, you said some women, most women will have a lump at some point in their breast and everything like that. What are typically the reasons for that? And is it maybe like a workout thing or a pulled muscle perhaps?
That's a fantastic question. Many women will get breast lumps that are hormonal. In your breast, you have two kinds of things, two kinds of tissue. You have the actual breast tissue that makes milk for the baby, and then you have fat. And the breast tissue itself can have cysts in it that form like little bubbles in relation to your hormones. Also, if you bump your breast, you're cleaning, you're mopping, whatever, you get a little bump, you can get a bruise in there that will create a little lump. So those factors that you mentioned, most commonly they're hormonally related. Okay.
Can benign cysts become cancerous? Non-cancer cells, can they perish of thought? Can they evolve?
Not commonly. If they're benign, then they are not cancer. Very rarely can they turn into cancer. But women with a lot of breast problems, like benign lumps over and over, cysts over and over, they have breast issues and they are more prone to breast cancer. So they have to be extra careful. Okay,
of course, we're going to talk about the self-exams that every woman should be doing. And as you said, women should be giving themselves breast self-exams once a month. But how about mammograms? At what age should women start to consider or start going in for those regularly?
Right. So that's a super important question. So mammogram, the recommendation now is to begin at age 40 and then do it every couple of years at least. There's some controversy about every year or every couple of years, but at least if you get one every 2 years, in addition to doing your breast exam every month. And the reason for that is because breast cancer is the disease of older women in general. We all know of the tragic case of a young woman with breast cancer in her 30s or even before that, but those are rare. Most women have them over the age of 40 and actually over the age of 60. So screening looks for disease in everybody without having a lump. You're just looking for a silent, totally undetectable disease. You cannot feel it, you cannot see it. You're just looking for it with the mammogram. And over age 40, your breast tissue becomes soft enough. There's less of that dense milk-producing tissue and more of just fatty tissue that you can see through with a mammogram. And so over age 40, we recommend every couple of years.
Okay, and then real quickly, it's also possible for men to get breast cancer as well.
It is. Every year, about 2,000 men in the United States get diagnosed with breast cancer, and that's quite rare considering how many men there are in the States. But it's a rare disease, but can happen. So if men find a lump in their breast, they should also get it checked.
Okay. Well, we do have many Facebook questions to get to, so we'll get to you in a moment. So sit tight, and you there in TV land, stay tuned because the good doctor will return when Healthy Living Tuesday returns right here on KUM Extra. We're talking about breast exams tonight, so stay with us.